Imagine, what the hell is that? Ladies and gentlemen, I just initiated your fight or flight reflex. Your fight or flight reflex is a reflex controlled by your hypothalamus in your brain. It is a reflex that evolutionary was designed to quite possibly save your life. This reflex is a little bit more prominent in others than some people, like myself. And a lot of times it's due to a life-changing experience such as combat. Often, this leads to a diagnosis of post-traumatic stress disorder, a disorder in which I was diagnosed with when I came back from Afghanistan in 2011. There are two main types of treatments for PTSD, to include psychotherapy and medication, among others. Life with this disorder can be a challenge, albeit one that can be managed with treatment. Today, I'd like to share with you how PTSD can develop and just how some treatments can help with PTSD, like myself. The criteria to be diagnosed with PTSD, according to the Department of Veteran Affairs and the National Center for PTSD, are as follows. First, the person must be exposed to one or a combination of the following: death, threatened death, actual or threatened serious injury, or actual or threatened sexual violence. Second, the person must experience what are called intrusion symptoms, which include traumatic memories, nightmares, flashbacks, trauma-related stimuli, or traumatic reminders. Then, persistent, effortful, violent avoidance of trauma-related thoughts or feelings, or external reminders such as people, places, conversations, activities, objects, or situations. Then, negative alterations in cognitions and mood must be present, such as distorted blame of self or others, inability to recall key features of the event, or even feeling alienated from others. Next, alterations in arousal and reactivity must be present, such as sleep disturbance, hypervigilance, or an exaggerated startle response, all three which I have. The duration of the persistent symptoms must last for more than 1 month. Functional significance, such as functional impairment or symptom-related distress, is the 8th criteria. Lastly, exclusion, which in case none of the above mentioned were created from medication, substance use, or any other illness. Psychotherapy, or counseling, is usually the first treatment. Cognitive behavioral therapy, or CBT, is the most effective treatment for PTSD, according to the U.S. Department of Veteran Affairs. There are 2 types of CBT. One type is cognitive processing therapy, where the skills to understand how the trauma has changed the individual's thoughts and feelings are learned. The second is prolonged exposure therapy, where talking repeatedly about the trauma until it no longer upsets the person with it occurs. Another type of therapy is called eye movement desensitization and reprocessing, or EMDR. It is a similar type of therapy which involves focusing on the sounds or hand movements while the trauma is being talked about. Some medications can be effective too. Selective serotonin reuptake inhibitor, or SSRI, and prazosin are two types listed by the U.S. Department of Veteran Affairs. A third is a lot more controversial. SSRI blocks the reabsorption of a neurotransmitter called serotonin in the brain. This helps cells send and receive messages chemically, helping to boost one's mood. Prazosin is a type of alpha blocker that works by blocking certain nerve impulses. Dr. Simon King, assistant professor of psychiatry at the Mayo Clinic in Rochester, Minnesota, explained in an interview with Dr. Daniel Keller that the reason we think it works in the setting of nightmares is that prazosin crosses the blood-brain barrier so it gets into the brain and dampens the norepinephrine effects which we think contribute to nightmares. The third and most controversial medication is marijuana. While still considered illegal by the federal government, some states have legalized medical marijuana. Although the VA does not give prescriptions for marijuana, Thor Benson, a reporter for UPI Top News in Washington, reports that a new bill called the Veterans Equal Access Act, which was introduced by Representatives Earl Blumenauer, a Democrat from Oregon, and Dana Rohrabacher, a Republican from California, would allow the doctors from the Department of Veteran Affairs to recommend use of medical marijuana to treat PTSD. Benson states that studies have found the use of marijuana in combination with therapy to be effective for treating PTSD. There are many situations in which one might end up with being diagnosed with PTSD. Not all are combat related, however, veterans are the most prevalent. Unfortunately, 22 veterans commit suicide every single day. This is more people than what are currently sitting in this classroom. With proper treatment, to include any combination of therapy and medication, PTSD and its effects can be limited. However, it is plausible that those who have it will have it forever.